Welcome to The Heart of Health Live. There's a place for modern medicine in your life. Learn to use it correctly by getting your toughest questions answered on today's broadcast. Discover modern medicine's strengths and weaknesses. Lifestyle medicine opens the door to optimum health and healing. How you live and what you eat can profoundly affect mind and body. Learn simple solutions to complex problems. God provides the ultimate healing we all desire. He wants us healthy and happy. We just need to understand His plan for our lives and live accordingly. And now, live from Studio 1A in Chattanooga, Tennessee, here's your Heart of Health host, Dr. James Marcum.
Welcome to the Heart of Health Live, where you are the program. I'm so glad you've taken time out of your busy schedule. You know, right now, many of you might be surfing the network. It's news time all across America, and you've stumbled on this program. Well, I think you're going to want to stay on this channel because we have information that can literally change your life. Tonight's guest, Dr. Czerkasij, he's a skin professional. He's going to answer your questions regarding dermatologic issues. No one wants to have skin cancer. We're in the heat of the summer. He might help you identify a skin cancer, especially a melanoma, which are particularly dangerous. We'll have some time to talk about this. If you want to join in and ask your question personally, we're one of the few health programs in the world that answer your questions live. We don't sell a product. We just want to give you good information. Our telephone number, toll free, 855-644-3278. And now, in the area of texting, you can give us a text at 423-834-7307. Now, if you happen to be watching us on the internet, you can go to our website, go to the Ask Your Doctor question, put a question in, and we're hoping you're also one of our Facebook friends. We give information about health topics. We help people grow. Now, one thing we want to let people know that our program's a little bit different. You're going to enjoy meeting Dr. Czerkasij. He's exciting, but we're going to talk about skin. But more than that, we want to let people know that there's a balance. There's a place for modern medicine. There's a place for lifestyle. But we believe it's in that unique relationship that you have with your Creator that you can find ultimate healing and truth. And we want to plug you into that thought today as we move forward. So after break, I'm going to introduce you to Dr. Czerkasij. We're going to talk about his life, how he got interested in the field of dermatology, and answer your questions regarding skin care and all that. So stay with us. Our phone number, 855-644-3278.
The Heart of Health Live will return in just a moment.
The Heart of Health Live is brought to you by Heartwise Ministries. This year, it's estimated that 56 million people will die. Some from old age, some from disease, and still others from terrible tragedies. At Heartwise, we can't do anything about sudden death, but what we can give you is free medical information that will help you live a longer, more fulfilling life with less disease and illness. If you are interested, we would love to talk to you about our wonderful God whom we love and serve, who is with us even when we are going through heartache. If you have a medical question, or if you are just at the end of your rope, call us at 855-644-3278. At Heartwise, we believe in truth, love, and healing. The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com.
Body language. Without saying a word, that can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Okay, I want to welcome you back to Heart of Health Live. And yes, we do have answers, but we need your questions. Give us a call. Our phone lines are open. Our operators are standing by at 855-644-3278. We want to hear from you because if one person has a question, many people have it. I want to introduce you now to Victor. I'm just going to call you Victor. Is that okay?
That's what I was born with.
Well, that's a good name to have. Well, I want to thank you, first of all. I know you actually saw patients all day in the office.
I sure did.
And I bet you saw all sorts of things.
That's why I like dermatology, is you never know what's going to be behind that closed door. So when we open the door, it's exciting. It could be acne, psoriasis, eczema. There could be something bleeding that won't heal, hair loss. You just never know.
Now, how long have you been working in the field of dermatology?
I joined Dr. John Chung, who's my mentor and well-known surgeon for skin cancers here in America back in 2002. So this is my 13th year with him.
And you had to go to Vanderbilt, do some training.
Vanderbilt University, located in Nashville. I had a wonderful experience there. I'm now a faculty there at an adjunct.
Good.
And I teach dermatology. My next lecture will be this November. I do a suturing workshop as well.
Okay, so if anyone wants to do some suturing, you know where to go. Right. Now, you do see patients every day. You're just not just giving lectures. You see patients every day in the office. That's bread and butter?
Jim, that's what I do. I see about 50 to 60 patients a day. I know that other folks in healthcare may see less, but it's a different acuity, we call it. It's the largest organ of the body, the skin. And fortunately for me, unlike maybe yourself working as a cardiologist, I get to see my body organ on the outside when I help patients. So it's really important that I see as much as I can, too.
So if you have a question regarding skin care, this is your chance to talk to a professional. He won't charge you anything, 855-644-3278. And you brought a model of the skin here. Why don't you sort of show us some things on this model so we can all learn a little bit about the skin?
Well, I did mention that our skin is considered the largest organ of the body, though for the healthcare professionals listening in, some people feel the vascular system may be up there as well. But for sake of argument, we've got quite a bit to show the rest of the world. It comes in all kinds of colors and shades, but the bottom line is we do have what's called our epidermis at the surface. We have our dermis on the second layer, and then of course we have our subcutaneous here in the bottom layer, which is our fat. And knowing and understanding how these interact with each other gives us an idea, a clue for a diagnosis and then treatment.
Well, that's very interesting. And you know, different skins have different colors. And I guess from this layer down below, all of us are pretty much the same structures?
Yeah, the moment you cut into someone, they're going to have red blood.
Okay.
So that's the same. But what gives us our shading in the surface, of course, is genetics and exposure to the sun. The more sun that we get, then of course the more melanocytes will develop or activate in order to absorb the ultraviolet radiation.
Okay, well we have a bunch of questions coming in. And first, before we get our live calls, we're going to start from the questions that come from our website.
Sure.
That you can help if one person has a mini. And this first person writes and says, listen, I have a funny spot on my arm and I'm concerned that it might be skin cancer. I know I should see my doctor, but what are some characteristics that might help me determine whether this would be skin cancer?
That's a great question, and I'm glad it came in. In fact, skin cancer and melanoma is a big part of my day. I kind of live here in the southeast, of course, where a lot of us believe it's the center of skin cancer problems in the nation, though Hawaii ranks as the highest per capita, in fact. If something is come up de novo, we call it, or it's something that's never been there before, and it starts to bleed, ulcerate, itches, and this persists for weeks into months, some people will allow, then of course we need a biopsy to determine what it is.
Okay.
When we have a single solitary lesion that just won't heal, this is highly important that we biopsy to determine what kind of cancer and at what depth. What's interesting, Jim, is that we name our skin cancers based on where they come from.
Okay.
For example, the squamous cell is in the shallow or squamal epithelial lining. So people ask me, is that a good cancer?
No, no good cancer.
No good cancer,
Right.
but I know what they mean because we make up half the cancers in America. Of all the cancers that will take place, skin cancers will be half.
So it's the most common.
Very common, very curable in the early stages, but people have passed on as a result of delaying treatment. So squamous cell is a fast-growing cancer, but it's shallow.
Okay.
So we can catch it quite quickly and treat it early on. Basal cell, base layer, a little deeper, is slow-growing and destructive. It could take 30 years for that to show itself at the surface. So you can have a severe burn at 18 and it'll be maybe 40 or 45 years, you might be 40 or 45 years old before it shows itself. Melanoma, which is another common cancer, and there's 5 varieties, is of course a replication of the melanocyte. And there's superficial spreading, nodular, lenticular, I mean, they're just different types. The key is, if it's something you haven't had before, or something you've had a long time and starts to bleed, come on in.
And what about the edges? Does that help you at all? If the edges are smooth or irregular?
That's interesting you brought that up. Right now in dermatology, we have 5 official principles that we follow.
Okay.
One is asymmetry, one side different from the other. B, border. Could be irregular, or is it smooth, or is it fragmented, is it falling apart? C, color, is it one color, changing color, multiple colors? D, diameter. We look for about the end of a pencil eraser, or just right here, about 5 millimeters, though now it's showing a lot of melanoma are at about 2 millimeters, which is really small. And then of course E, evolving.
Okay.
I'm adding an F one day.
Okay.
Do you know what the F is?
Nope.
Okay, you've heard it here first on this program.
What is it?
I'd like to do an article and some research on A, B, C, D, E, and then F, which would be feeling.
Okay.
Sometimes someone will come in and it looks great, but they'll say, you know, Victor, it just itches terribly.
Okay.
It just hurts, there's a sensation, and I biopsy it, skin cancer.
Wow.
And it didn't have some of the other criteria.
So I think we should add that one.
I think we should. A, B, C, D, E, F.
Well, that is new, and you heard it here
You heard it
live
first.
at the Heart of Health Live. Now, getting back to this question, so it looks like this person is concerned about something on their arm. You know, what would you, I'd probably tell them to get a biopsy. What do you think?
Time to get a biopsy.
You know, even if it might not be anything, it's better to know. Better safe than sorry.
I'll sleep better, and so will they.
Yeah. I've had several people that I've known, that patients that have had melanoma, and they've caught it too late, and it's at young ages. It takes their lives.
Yeah, the key is, of course, we have different staging for melanoma, 0 through 4 we call it, and they're changing some things around. And I will say that we have some dramatic different medications that are coming out just recently in the last year or two that can prolong life a little more. But the staging determines what we'll do next. For example, in the early stages, we can do a Mohs micrographic skin cancer surgery, which we'll explain. And later stages will require a sentinel biopsy, which tells us we know it's melanoma, but how far has it gone? Would that require chemotherapy or radiation or an oral medication that they have now? So staging tells us what we're going to do next.
Yeah, and that sort of lets them know. So I hope this information is helping you, and I hope that answered your questions. We want you to give us a call. Our phone number, 855-644-3278, or you can give us a text at 423-834-7307. Our phone lines are open. You can answer a question, and all the questions are great. And I'm sure Victor will be able to answer you. Now, after break, we're going to talk a little bit about the Mohs surgery and a little bit about how cancer is treated, especially in skin cancer is treated. And we have another question that's just come in regarding protection of skin, how you keep skin cancer from occurring. You know, everyone has questions about sunscreen. So we want to encourage you to stay with us on Heart of Health Live. Join us on our webpage, heartwiseministries.org, or be one of our Facebook friends. We're going to be right back learning about dermatology, answering your questions, and yes, you are watching the Heart of Health Live.
The Heart of Health Live will return in just a moment.
Kids will spend 8 minutes decorating their little brother.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Heartwise Ministries would like to invite you to take a moment and connect with us and share your thoughts and comments. You can join the conversation on Facebook. You can follow us on Twitter. HeartwiseMinistries.org will help you stay up to date with what's going on. And of course, you can always watch past shows on Vimeo.com.
Medicines That Kill from cardiologist Dr. James Marcum is now available. In his newest book, Dr. Marcum explains why he believes that medications may very well be the #1 cause of death in America. Medicines That Kill uncovers the hidden risks associated with modern pharmaceuticals and outlines the biblical plan for physical and spiritual health. To find out how to get your copy, visit our website at heartwiseministries.org or call us toll-free at 855-644-3278.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We're glad you joined us. We're talking about the skin, and in August or whatever season it is, it's always good to know about the skin. Victor, we're talking a little bit about the Mohs procedure, and I know Dr. Chung is one of the foremost in the United States in treating this. Can you just tell us what is a Mohs? What is the Mohs procedure? It sounds sort of scary. You want some Mohs?
That's
no,
right.
I don't want Mohs. You heard the restaurant. Welcome to Mohs.
Welcome to Mohs.
It's not that.
It's not that. You actually want Mohs because it's going to save you from
now, how's that spelled?
more trouble. Let me tell you about that. Mohs is named after Dr. William Frederick Mohs, M-O-H-S.
Okay.
Dr. Mohs pioneered a wonderful procedure at the University of Wisconsin, which allows us to identify exactly where the cancer is and spare the healthy tissue. Now imagine if you have a cancer on your back or your arm or shoulder. I have a large space that I can work with. What we'll do in surgery is cut that area out, sew that up, and we'll send the tissue off to pathology, and we got it, because we can take what's called wide margins.
Right.
You've got the room to play with. But what if your cancer's on your eyelid or your ear, tip of your nose? What about your lip, genitalia? You can't just go in and cut the whole area out.
Right.
I mean, it doesn't do anything
Where's your nose?
Where's your nose? And that's a problem every day that we face. So Dr. Chung, who was able to meet Dr. Mohs before he passed away, and John is known as one of the foremost Mohs practitioners, surgeons in the world today. He has under his belt nearly, are you ready for this?
Yes.
Nearly 100,000 surgeries have been done under his auspices.
Wow.
That is a lot. I doubt that many people have done 100,000 of anything.
That's right.
And this is a real feather in his cap, so to speak. And for me,
Well, what a talent that God's blessed him with.
to be able to train under someone like that has allowed me to progress as well in the area of cancer identification and surgery and suturing techniques. He's a hard taskmaster, but he was exactly what I needed in my life and for those who trained under him. But what we do is, very quickly, I know it's only an hour show, but we'll go ahead and take out the area that we already know is cancer, and then very quickly we'll freeze that tissue, mount it on slides, and look by pathologists under the microscope after marking it with different colors. This tells us exactly where it is. Is it moving superior, up? Is it moving down inside, inferior, off to the left or right? So this tells us where we should take our next piece of tissue. Now, if there's clear tissue all the way around with no cancer cells,
You're done.
we're done.
Good.
And so we use plastic surgery skills at that point to close the defect.
Wow.
And that's what it is, in fact, at that point.
And I guess you would use that for every type of skin cancer.
And location on the body as well.
Right.
So we have different types of forms of closure depending where we are.
Wow.
Some of them are two-part procedures. For example, if you lose the entire tip of your nose, we can take parts of your cheek and we can reform the nose at that point. Then you'll come back and we'll remove the fingers and then your nose remains here. Interesting point. You can close your eyes and touch your nose in the early months and your brain is telling you you're touching your cheek. Or if you're a man, you'll have to shave the end of your nose until the body knows it's a nose now.
Wow.
Yeah, so there's some adjusting.
That's interesting. So that's one of your ways of both diagnosing and treating.
Yes, that's right from beginning to end.
Well, now, would the, do you do this in the office? Or
Yes.
Okay, so you would have a pathologist on site?
We
in the
do.
office?
It's an in-office procedure, and the person receives local anesthetic. And while we're after we've removed the tissue, they're waiting in the waiting room. They're awake.
Yeah.
There's no pain involved. We make sure it's cauterized. There's no bleeding. And then we bring them back either for more tissue or closure.
Now, we've talked a little bit about in the first segments about skin cancer
Yes.
and its prevalence. Do you think over the years you're seeing more cases of skin cancer, less cancer, or are people becoming more aware?
It's a great question because we receive ideas and comments from across the sphere, so to speak. Some people think we've just become better at identifying. In 1935, it was in America, 1 out of 1,500 people had melanoma. Today, in 2014, it's about 1 in 45.
Wow.
Now, is it because we're better at identifying skin cancer and melanoma? I like to think, if you look at Coco Chanel, who was on the French Riviera in the 1950s, she brought tanning into vogue.
Okay.
It showed to the public or your friends and your sphere of influence that you had time on your hands and means. And so I received a tan, where for hundreds and hundreds of years, particularly in the Caucasian race, not to have color showed that you were wealthy. Now it's flipped.
Yeah.
And the bathing suits have changed from the 1930s as well, when they were pretty much from your neck to your ankles. And now, of course, little left to the imagination.
So there's more skin, more sun exposure. Yeah.
Even worse are the tanning beds.
Yeah, what do you think about tanning beds?
Well, I know that there's folks that might even purchase them to have in their home, but it has been determined by the World Health Organization, without a doubt, based on all the research and the facts, that the same effect that cigarettes have on lungs, sunshine, and ultraviolet has on skin.
Okay.
It is a cancer producer and an ager as well.
Okay. Well, we have got a question from Nevada. Anna, you're on with Victor. Go ahead with your question or comment. Anna?
Thank you, doctors. I have a question, 2 parts. I'd like to know the best way to get rid of a whitehead or whiteheads without making scars.
All right. Okay. That's the first question right there, Anna?
Okay, let's tackle that.
That's the first part.
Let's do that. We're going to do that one first, Anna. Go ahead, Victor.
Anna, here's how I can answer that. There's 2 kinds of comedomes, we call it. The first one is an open comedome, which is a blackhead. And that's a pore that has sebaceous material and some dirt's fallen on it. That's a blackhead. A whitehead is a very slow growing gland that has built up, and of course there's some skin over the top of that. It's a mechanical removal, Anna. What you have to do is have either dermabrasion or you can use a loofah, but it's going to take a little time to open that up. If it's 1 or 2, you can use a sterilized pin and have someone break that, and you can lightly squeeze. Remember, you won't have scarring if you allow the pore to close naturally. But if you continue to squeeze a great deal, and don't keep drying products on your skin like a benzoyl peroxide or a salicylic acid or a retin or vitamin A cream, then you could scar.
Okay. Okay, what's your second part, Anna? That was great. What's the second part?
I have used activated charcoal with a bandage and had good results at one time, but I know it takes a while.
Activated charcoal is known throughout the world for its absorption products. I have to say that a lot of my answers, while I want to stay with natural healing and health and prevention as much as I can, there's not a lot of research that shows that works on whiteheads. Was your question on activated charcoal in regards to whiteheads, Anna?
Yes.
Well, you're going to have to tell me how that works. I know that it absorbs, but I've never heard of activated charcoal absorbing sebum or oil.
Okay, Anna, did you have anything else you'd like to ask Victor?
Yes, I told the lady that I spoke with about my second part of my question, and I'm sorry, but right now I don't have a note about it.
Okay, well listen, be careful in Nevada. There's a lot of sun out there. So be careful in the sun, and we just want to thank you for calling, Anna. So we wish you the best, and hopefully that will work for you. These questions are very common. If one person has them, lots of them. And I'm just hoping that we can at least let people know to check their skin, prevent cancer from happening. We are going to talk after the break. We're going to talk a lot about some sunscreens. There's been a lot of questions and concerns about sunscreens.
Let's do it.
What strength, whether we need them, whether they damage our skins. There's lots of confusion about that. Which is the best one to buy? Whether there's generic versions. So stay with us. We're going to tackle the sunscreen question as well as your questions on Heart of Health Live. Give us a call.
The Heart of Health Live will return in just a moment.
I'd like to think that one day, when we get to heaven, we're going to see a list of people like Jared and Susan, who were introduced to Jesus because of something we said. Or maybe it was as simple as a passing smile. But these people will look into their past and be able to say, I'm here because of you. Recently, you may have heard that HeartWise Ministries has begun spreading the gospel to the young, the old, the sick, and the healthy using this very television program. But we need your help. We want to take this type of medical programming to the non-believer and the person who has closed themselves off to traditional forms of outreach. If you believe as we do and want to support HeartWise so that together we can count more names on the Tree of Life, please consider donating today at heartwiseministries.org. That's heartwiseministries.org.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
Well, we're glad you've called in to the program. Our stations are waiting, and we're receiving your calls. We're going to get as many on the air as we can, and I just wish everyone would call a little bit earlier, because this is what happens every week. We get lots of questions at the end, but don't worry. If we can talk Victor into it, we're going to have him come back again. We're going to get all your questions answered eventually, and I'm just so glad we have the ability to answer your questions and to serve you. Because, we're not selling a product, we're just giving good information. We want to let you know that there's someone out there that will listen to you, that cares. And we also want to introduce you, if you have a relationship with your Creator, I want you to think about that, because that's the ultimate path to healing. Because all of us are going to wear out someday.
That's right.
And when you have that relationship, we have an ultimate physician that no matter what, he's never too busy for us, the office is ever open, no paperwork, you can come right there and talk to him, he's always there.
And those poor people that tell me that they wish 30, 40 years ago that they didn't have so much sun exposure, maybe wore some sunscreen or some clothing, and they're tired of having surgery after surgery, I remind them there's a resurrection or translation body coming. So
there you go. We have Lori from Oregon. You're on, Lori. Go ahead with your question, Lori.
Okay, well, thank you for taking my call. My question is it more common to see skin cancer from a tanning bed or from the sun naturally?
The research shows that right now, tanning bed and enough ultraviolet radiation should be about the same. But on the melanomas, we're seeing a lot more of them, and at a lot earlier age, thanks to tanning bed. And that is research. Quick story, I remember a young lady came in, 8 years old, brought by her mom, and Jim, she had warts on her finger, the little girl. And as I turned to talk to the mom was 33 years old. And I said, you should be our patient. She said, I have nothing wrong with me. I said, I can see on your chest here what looks to me like a small skin cancer. I said, why don't you go ahead and put on a gown here in a moment? We'll make you a patient in the next hour. Not any exaggeration. At this point, we have found 35 to 40 skin cancers on this woman just in the last 2 years. I said to her that day, do you have a tanning bed? She goes, yeah, I've been using it faithfully for the last 5 years in our home. I told her not to give it to anyone. I told her to just get rid of it.
That's a great idea.
So the answer for melanoma is yes, increase of melanomas thanks to tanning bed use.
Any other questions, Lori?
I guess you can see it from all ages now. It used to be something when you're older you would see possibly on your face or your ears, but now it seems like all ages are getting this if they're tanning too often.
Lori, that's right, because the youngest person I've done surgery on for a melanoma was a 2.5-year-old girl. She's 8 years old now, but she was 2.5 years old. It was on her ankle. That said, there was no tanning bed. She would have got that melanoma had she been born and lived in a cave, because it was a genetic propensity. People who are Celtic, Scotch-Irish, Dutch-German as well, they have a greater propensity. That said, you can be African-American and you can get what's called an acrolentigenous melanoma in the palms of hands, soles of feet, and the nail beds. We look for that as well.
Okay.
But we do see it earlier and more devastating.
Okay, Lori, thank you so much for your call, and that was a wonderful question. We're glad you're watching this evening. Now, we always have the question about sunscreens.
Sunscreen, big issue.
I thought the sun was good, vitamin D, serotonin, I thought that was good, and yet there's so many products. So what's your perspective on this?
Jim, the key word right at the beginning is one we should exercise in all of healthcare, and that's balance.
Okay.
I am not against the sun. The good Lord created it for a purpose, and of course our bodies can interact. As you can see myself, I have some sun, and I do, and I think it's important for vitamin D. What I ask my patients, and I'll ask our audience, is please don't burn. Don't burn. That is one of the most important things that we can say right off the bat, simply because burning is the key that replicates or stimulates DNA to replicate, and that is essentially the definition of cancer. A lot of you have probably been online and you've Googled something that might say that sunscreens are bad, they cause cancer. Absolutely untrue. As a faculty at Vanderbilt University, I can tell you that the research has been showing that those who say sunscreen can, at certain temperatures, be absorbed into the system and be carcinogenic is true if you're living on the planet Mars.
Okay.
You have to have about 400 to 600 degrees in order to break the compounds down in sunscreen.
Oh, wow.
So we don't receive that. Also, secondarily, all the research has been on hairless rats. Our skin is fundamentally different between rats and ourselves. There's been no proof medically. Now, if you're going to believe that, I can't change your mind from the facts, then that's what's going to happen. But you'll be burning.
So what strength should you put on?
You know, we have a joke in dermatology when they ask what's the best sunscreen? The one you use.
Okay.
So the one you use is your best sunscreen. I like 30 to 45. Anything really over 30, you're wasting your money because it only applies, it gives you a 2% increase of strength, but it's a lot more expensive. Okay. So I put 30 on before I go to the beach if I'm going to be there all day. Interestingly, as far as vitamin D is concerned, all you need is about 20 minutes to half an hour of unrestricted sun every day, preferably by 10:30 and after 2 o'clock. You'll get everything you need. Jim, if you get more than 30 minutes of unrestricted sun, all the research shows you start destroying vitamin D.
Oh, really? Okay, so there's a magic number.
Yeah.
Now, there's a lot of products out there. Does it matter whether you get the more expensive one or the cheaper one, or does it really matter?
You know, I'm not pushing a line, but people do want to know. There's a product line out there called Vanacream, and I don't work for the company. I have no stock. I have no interest, no kickbacks whatsoever. Love to have stock, but Vanacream is a great line because it's hypoallergenic. It's PABA-free, dye-free, fragrance-free, lanolin-free.
Okay.
It's just not free.
Now, how do you spell that? Because we're going to get lots of people asking.
Vanacream is sold nationally, usually behind the pharmacist's counter since it's a little more expensive, and it's spelled V-A-N-I and then cream, C-R-E-A-M.
Good.
And I think it's a great line. It's very safe and hypoallergenic.
Okay, great. We have Josie on from Tennessee. Go ahead, Josie. You're on with Victor.
Hi. Good evening.
Hi.
I always watch program. I have a question. I have been experiencing this itching on my head for about 2 years now, and itching on the scalp. There's no lice in it, but it is seems to be moving around, and it starts on the top. It's going around my head, and it drives me crazy. I just want you to know what you can suggest. Sometimes there are bumps on it, but sometimes not.
Right. Well, you know, your question is interesting because there is now a subset in dermatology of individuals who only treat itching scalps. Can you believe that?
I do.
Talk about a subspecialty.
Yeah.
But they only treat itching scalps. We find it very challenging. Now, it was Josie, was it? Mm-hmm. Now, Josie in Tennessee, your question is a difficult one because we have to find out your medications. We find that blood pressure medications and statins, I know you're in cardiology, we find that those cause a great deal of itching. Seborrheic dermatitis, which is a fungal yeast overgrowth in the scalp, can cause that. Also, I can tell you that from scratching it enough times, you'll start a histamine reaction, which causes the bumps. And so that becomes itchy on its own. And those bumps we call prurigo nodules. If you scratch enough, it's a vicious circle. So that would take a workup to find out exactly your medical history, what medications you're taking, a close examination, or I'm sure it's not lice, and to find out what's happening.
So she'd probably check in with the dermatologist.
She really should.
Yeah, and you should do that, especially if it's been going on, because no one wants an itchy head.
Got to see this. We have to see it.
Thanks, Josie, for calling us. After the break, we're going to have to go to break again. We're going to talk about acne. Lots of people have problems with that. We also have some text questions that have come in that we're going to answer. We want to thank you for staying with us. We're learning a lot about skin cancer and all sorts of skin conditions. We're going to be right back after this short break.
The Heart of Health Live will return in just a moment.
Body language. Without saying a word, it can tell you so much. like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment, and that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
Meet Charlie. He's a normal guy with a big problem. You see, Charlie doesn't like to eat healthy foods, and now he's overweight and doesn't know what to do about it. Luckily for Charlie, he's found Weight Management by the Book. Weight Management by the Book is a complete weight loss solution that includes 7 DVDs with 5 hours of lectures, a workbook with over 100 healthy recipes, and an exercise band so you can exercise at home. Dr. Charlene McCullough is a nutritionist, author, and speaker, and together she and Dr. James Marcum talk about the practical ways you can manage your weight and do it the way God intended. As it turned out, it was the best decision Charlie could make because he was able to lose weight and feel great. So now that big problem Charlie had is no problem at all and has completely gone away. Don't you want to know how to manage your weight God's way? For a donation of any amount, we'll send you the complete Weight Management by the Book set of DVDs, workbook, and exercise band. But hey, don't take our word for it. Here's what others have to say about our program.
Weight Management by the Book was an answer from God.
I love that this program focuses on relationships as well as diet and exercise.
Thank you for giving me the hope to change and for doing it in a loving way.
So what are you waiting for? Visit our website at heartwiseministries.org or call our telephone number 855-644-3278.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
We're glad you've joined us, and for those watching on some networks, they didn't catch the first part, but we're here with Victor Czerkasij. He's a specialist in dermatology. He sees patients every day. He's been answering questions, and there's so many that's come in. We might have to table this for another time. We also want to thank Alla and Wesley, special friends of mine, who actually are special friends of Victor, who happen to be his parents that are watching tonight. I know they're proud of you.
They are.
They're proud of you.
I'm proud of them.
Good stock, that's, good stock,
Thank you.
Helping people out. And it's a pleasure to have someone that's willing to give their time after seeing patients all day long, that's willing to serve other people, answering their questions. And right now we have a question from Rose. Rose, you're on with Victor. Go ahead, Rose.
Yes, sir. 2 questions. One is, what is the strongest, because I don't know if you already answered this question or not because I had you on mute. One is, what is the strongest sunscreen that I can get? Because I'm Italian and I am as fair as anything, like Scandinavian, and I burn easily.
Okay. So right off the bat, the strongest sun shield? Stay inside.
Yeah.
In all seriousness, we have what are called sunblocks. Now, we all know traditionally, Rose, that there are sunscreens, but sunblocks are classic. For example, zinc or titanium oxide or zinc. You'll ever see some people that put on this white paste.
Yes.
That is a block. And if that's not good enough for you, if you go online, there's a whole series of companies that sell sunblock clothing that's impregnated with special chemicals that don't get absorbed in the skin, and they reflect the light. And there are hats and shirts and pants. In fact, in Australia, if you allow your child to be sunburned, that's a reason for Department of Children Protective Services to come in. They take it so seriously because it's an absolute scourge there. So zinc or titanium oxide, which is a paste, or certain clothing is a sunblock.
Okay, but now the sunscreen, what would be the most powerful sunscreen on the market?
Well,
I guess you as much as you want.
The FDA, I talked to the head of the FDA personally a few years ago in Washington, D.C. at a conference, and they told me at that time they were going to redo all of our sunscreen labeling in this country. They're still not out with those products just yet. But I, again, would recommend a 30 and just repeat that every half hour to an hour.
Okay, great. Rose, your second question.
Okay. The second question is, a good number of years ago when I was a little kid, about 13, 14 years old, I got first, second, and third degree sunburn, and I was wearing clothes, and it was in the wintertime in Florida. My whole body just got burned. And they rushed me to the hospital, and the doctors used apple cider vinegar, just put me in the tub and started pouring this all over me. I didn't blister, but am I at risk for maybe getting some kind of skin cancer now or years later? You know?
Thank you again. The short answer is yes. We do know that every time you have a burn, you increase your percentages just slightly of receiving skin cancer down the line. However, most likely that burn may be history by now. I imagine the way you're talking, you might be in your 40s. Are you about 40 years old?
Next month I'll be 62.
Oh, wow. Wonderful. Okay. Keep going. 62 years old. Well, here's the thing. About now is when we will be seeing any damage from that event. I doubt that you'll have that. I'm sure being of Italian stock, a little darker, you're able to absorb that. Terribly sorry about your burn. But if you go on a regular basis to see a dermatologist or dermatology provider, the American Academy of Dermatology recommends that everyone who has a personal history of skin cancer or someone that's direct line blood related, that over 40 you go once a year or sooner if you have some kind of lesions. I would recommend that you would go find someone to be checked out.
Okay. Well, thank you so much, Rose. Those are some great questions. And Victor, you know, we talk apple cider vinegar. Have you heard that before?
I've heard of apple cider vinegar and have recommended it for a number of uses. For example, one is some individuals don't want to take some very liver-destroying medications for fungal infections of the nail. One thing that Dr. Chung taught me, and we've used with some success, is taking 50% apple cider or white distilled vinegar mixed with distilled water.
Okay.
And soak that nail twice a day for about 10 minutes, which really isn't that long if you're watching the news or even reading a book. I suppose you can turn the page with the other hand. And within about 25 to 30 days, people will see some regression of the fungus. Even in bacterial infections, cellulitis in the fingertips.
Well, that is a good tip. Our next, I don't know if our next one's ready, but our next one doesn't have a name, but whoever's holding right now, I guess it's Rudy from California. Rudy, you're on with Victor. Go ahead, Rudy.
Yes. I'm really delicate, and basically, I'm already burned from the sun because before I wasn't using sunscreen, but now I am, and I'm trying to get all the vitamins from the sun, but I cannot even spend a couple minutes on the sun without feeling all the burn already. How do I get over that?
If I understand your question, Rudy, I think you're asking is you're in the sun very quickly and you start to burn. Was that correct?
Yes, because I'm already burned and my skin is really delicate. Even if I wear sunscreen, it's not helping at all.
Well, Rudy, first of all, thank you for your question. Second of all, remember for sunburns, a very effective product is aloe vera with lidocaine. You can find that over the counter. Aloe vera has some wonderful healing properties. With lidocaine, of course, it can numb the skin. Third of all, how do you avoid getting burned that quickly? Probably avoid the time of going outside between 10 and 2 o'clock. I have patients that I treat with discoid lupus erythematosus, lupus, an autoimmune disorder of the skin that's very degenerative, and they find that if they avoid the sun during the hotter parts of the day, they do better. Now, if this is maybe a job that requires you to be outside, once again, I would refer your attention to good clothing that you can find online, and it's called sunproof clothing. And along with some shading for your face, a sunblock like titanium dioxide, I think you should do better.
Okay, Rudy, we hope that works for you. And what part of California from, Rudy?
Probably southern.
Okay, I guess he hung up, but that was a good question.
It was a great one.
A lot of people are very sensitive to the sun, and And of course, some people are not, you know, and that's I guess there's a genetic component as well.
Yeah, and we have rosacea, of course, that a lot of older dermatology textbooks will refer to as acne rosacea.
Yeah.
But acne and rosacea are two completely different disorders.
Yeah.
And they have that red blistering. And you know, I have to turn and look at you there, Jim. I would guess that maybe you're Dutch German or English, Irish.
English.
Well, you're probably prone to rosacea, which is an inflammatory disorder made worse by top two reasons. Number one, excessive sun, and two would be stress.
Okay, does it come on any time of life, or?
It does. It starts at about age 40. Women are 8 times more likely to have rosacea than men, but when men get it, it's much worse. Some classic individuals that people might remember that had bulbous or rhinophyma rosacea, where the nose was swollen, W.C. Fields, Tip O'Neill, Bill Clinton. These are individuals. Renee Zellweger suffers with it, and I saw some pictures of Robin Williams this week, and he had very red cheeks. Obviously, makeup might cover it, but that was rosacea.
Wow, well, that was a good pickup. We still have a little bit of time left. We want to invite you to visit our website. It's heartwiseministries.org. You can leave more of your questions. We can have Victor back again. Go to our Facebook page. Become a part of our Heartwise family. Look at our website. We have some great places where people can pray for each other and also learn about eating healthy and being healthy. So we'll be right back.
The Heart of Health Live will return in just a moment.
I'm Dr. James Marcum, and I talk to patients every day who want to know the truth in healthcare. On our website, heartwiseministries.org, you can have your questions answered. You can read my blog where I talk about interesting and controversial subjects in medicine. You might choose to go to the radio or television sections and learn more about all sorts of health topics. Take the time and go to heartwiseministries.org.
Kids will spend 8 minutes decorating their little brother.
Brushing for 2 minutes now can save your child from severe tooth pain later. 2 minutes, twice a day. They have the time.
The Ultimate Prescription by cardiologist Dr. James Marcum is taking the nation by storm. People everywhere are learning what living a healthy life is all about. If you're happy living a drug-filled, pain-filled, mundane existence, this book is definitely not for you. In this book, Dr. Marcum dives into modern medicine's strengths and weaknesses and explains how lifestyle choices can significantly impact your health. To get your copy, visit Barnes & Noble or shop online at Amazon.com. This year, it's estimated that 56 million people will die. Some from old age, some from disease, and still others from terrible tragedies. At Heartwise, we can't do anything about sudden death, but what we can give you is free medical information that will help you live a longer, more fulfilling life with less disease and illness. If you are interested, we would love to talk to you about our wonderful God whom we love and serve, who is with us even when we are going through heartache. If you have a medical question, or if you are just at the end of your rope, call us at 855-644-3278. At Heartwise, we believe in truth, love, and healing.
You've got questions, we've got answers on the Heart of Health Live. Welcome back.
I'm glad you've joined us this evening. We're now in our last segment. We've had such a good time talking to Victor, learning about skin cancer, learning about sunscreen, and we're going to have him come back again because, you know, it's such a common problem in America now. Everyone's affected by everyone has skin.
Well, myself, I see about 60 patients a day, and it's remarkable that you can have so much variety just at the end of the week. Jim, I can tell you that not only is it the largest body organ system, but we have 2,300 diseases and disorders at last count. Not to discount anyone else's specialty, but there's a lot of folks who are frightened of dermatology in healthcare because to them it's just a rash. But there's a way to teach people to recognize and break down to what this could be. And I try to do the same for patients.
Now, when we see a rash, everyone has rashes out there, first thing I think of some type of fungus. That happens quite.
And it's least likely.
What's the most common type of rash that you see?
Most common one would be eczema, which we're trying to use the term atopic dermatitis, or dried out skin. Do you realize that in America today, or in Western civilization, a hot shower is completely anathema to the body, or the skin, I should say, in particular. But for the last 60 years is when we've enjoyed that. But for thousands of years, individuals did not have access to copious amounts of hot water. And Americans today, they wake up, they stand in the shower, they think about their day, they're steaming the wallpaper off the walls, and they're using harsh soaps, they don't moisturize afterwards, and they come to me and say, how did this go wrong?
There you go.
So I would say right off the bat, itchy, dry skin caused by hot showers and bad soap and not moisturizing is a big problem.
So you do a skin history?
I do, head to toe. I have to see, and in fact I do demand from our patients, if you're going to be my patient, I need to see your whole organ system. I'm sure that you would not want to be a good cardiologist and look at someone's right atrium or left ventricle only.
Right.
You want to see the whole heart. I want to see the whole skin.
Well, some quick questions that have come in through the years. What's the best way to hydrate your skin?
Probably drink water from the start. Oh, is that the, you were waiting for that?
No, I was waiting for that. That's what I would agree with. But if there are other ways to moisturize your skin that's very effective.
And just for the record, you did not prime me on that question.
No, I did not.
Okay.
What are other ways?
Other ways to do that would be to use a moisturizing soap, and if you like a hot shower, make it quick.
Okay.
And also apply moisturizer afterwards. And by the way, quick is defined by me about 3 minutes.
Okay.
Otherwise, cooler water would be much helpful.
Now, we've talked a little bit about rash. When would you consider a rash a problem? That would prompt a doctor's visit or a dermatologist visit. When would that be a problem?
Probably the most the time that you're scratching the itch, because that's going to start a histamine reaction. There's also a possibility of embedding bacteria. You know, we have E. coli, Pseudomonas, strep, staph on our bodies, acne, and any of these bacteria become opportunistic when you have a break in the skin. And I don't want to put people on antibiotics if I don't have to. Prevention.
Okay.
It's cheaper and less invasive.
Okay, last question we have for poison ivy. Any quick fixes?
I got a question for you before I answer that. What fruit do we enjoy that is related botanically to poison ivy?
Kiwi.
Is it really?
No, I don't know. That's just a guess.
It's mango.
Mango, okay.
But I would say really quick is probably a wash off with water and soap within the first half hour.
Get rid of it. You know, they got a lot of products out. Well, we're glad you joined us. Thank you so much for taking your time.
Pleasure.
We hope to have you back again. If you have questions, send it to our website. We'll get those answered. That's heartwiseministries.org. Become one of our Facebook friends. Join us on our webpage. There's wonderful places where we pray for each other. If you want to find healthy restaurants, we invite you to be one of our partners and write a review for us. We have lots of different things you can learn about relationships, watch old programs, or ask questions directly. Again, we want to thank you for joining us. We will be praying for you. And until next time, I'm Dr. James Marcum, thanking Victor for joining us.
Thank you.
And you've watched Heart of Health Live. We'll see you next time.